One of the most exciting parts of my practice over the past 5 years has been our ability to get patients through these operations with less pain than ever before. 20 years ago when I began doing these operations, it was not unusual for the patient to stay in the hospital for 7 days, often starting out with intravenous narcotics and then progressing to oral narcotics. And even with these very strong medications, the pain was never really well controlled. And it was sad and sometimes even scary to see these patients in the hospital and really struggling for sometimes a week, sometimes longer. Well, over the past 5 years, I think surgeons have really gotten the message that patients want to be more comfortable, and a lot of research that we have done and others have done have made these operations much more comfortable. And it's really fun. I now do nearly a third of these operations, and patients go home the same day. It's really exciting, it's fun. We're certainly one of the leaders regionally and perhaps even nationally in this area. Patients get blocks around their knee operations that allow them to be very comfortable yet very functional right after surgery. Now, despite the comfort, I emphasize to patients that they need to use that comfort in order to regain mobility and range of motion. We emphasize lots of ice and elevation, especially with knee replacement surgery. But these operations have become much more comfortable. Again, pain after the operation for both hip and knee replacement surgery is very manageable in 99 out of 100 cases. The exceptions are patients that are taking pre-operative narcotic oral medications. These patients have a tolerance for narcotic medications, and sometimes they require higher doses than normal, and pain control is a little bit more challenging in these folks. But even in those people, pain is typically very well controlled for the first 24 to 48 hours. At about 48 hours on the second day after surgery is when patients I think are most surprised by the pain that they're still having, and perhaps they sometimes have a spike in pain at this point. So I always warn patients about the day after surgery, because this is when I get the most calls about poor pain control. But it's really been exciting and rewarding for me over the past 5 years to see how comfortable patients are on the night after the operation. When 20 years ago people were writhing in pain and sometimes even crying, now they're comfortable. Often they're home in their living rooms watching television, and I get texts from my patients and they just tell me how good they feel, and it's just one of the most rewarding things of the past decade in doing these operations.